On this episode, I'm going to talk about TMJ dysfunction, or TMD, some causes that you've probably never heard of if you've done some research on Google or on YouTube, and also an easy way to fix it that's painless and doesn't involve any drugs or surgery. And as a special gift, if you are local to the Stuart area, you can find out how to save $150 and get a set of free upper cervical x-rays if you watch this video to the end. So stay tuned. All right, so maybe you have been suffering with TMJ problems with TMD for years. Maybe it started when you were younger, in your teens, and you've kind of grown up with this. You have difficulty eating certain things. You've got pain that's in actual TMJ. Maybe it's both sides. Maybe one is worse. You've got grinding and sounds that are happening in there. Maybe it's been going on so long that you've even had surgery, multiple procedures that have been done to try to get some kind of relief in that TMJ. Well, I want to talk about something that I'm betting you've probably never heard of, and that's the alignment, not just of your jaw relative to your head, right? Which you've probably seen a lot about if you've been to a dentist or some of these specialists, but it's actually the alignment of your skull relative to the horizon, right? If you think about it, the skull is a massive bony structure, right? It's a big giant bone. Well, that's what the jaw is going to articulate with. So if you can imagine, not just how is my jaw positioned, which you've probably hyper-focused on up until this point, but where is my head at for my jaw to even articulate with? So if you can imagine, if the head is slightly off axis, right? If the structures, the bones that are just underneath your skull, the top of the spine is slightly off, the head is going to have a slight amount of head tilt. That is going to cause, probably not in the short term, days, weeks, months, but over years, if you've got that slight head tilt going on over years, the way that your jaw articulates with the skull is going to be dysfunctional. Now, over time, the way that the jaw is articulating with your head, the way it connects to your head is at your TMJ. So who's going to take the beating? If your head is off axis and your jaw can't properly articulate with your head, it's going to be your TMJ. So instead of going and trying to get bite guards and different things, and over time getting surgery and things on your TMJ, the first step, if you are having any kind of TMJ pain or you've been diagnosed with TMD, would be to look at the alignment of the head and neck. So that's going to segue into atlas care, or atlas upper cervical care, the top bone in the neck. If you've ever had a car accident or birth trauma, if you've ever had a sports injury, anything like that, that can leave the top bones in the neck slightly off proper alignment, which can cause that head tilt. So how do you fix it, right? If you do have TMD, if you do have some head tilt going on, and you have had a history of some kind of neck injury, how do you fix that? Well, in this office, what we do is very specific work. We use digital x-ray to analyze the position of the head relative to the neck and atlas in space. So we take very specific three-dimensional x-rays of the head and neck, and that set of images goes into engineering software. Proper analysis of the head and neck relative to the atlas in space is done, and then we use that to correct the upper neck without any popping or cracking. We actually use sound wave properly aimed based on that engineering software to release the atlas into its proper alignment. As a result of doing that, we have a lot of success with patients who are suffering with TMD, and not just your patients who are recently having pain, like your teenagers and stuff like that. I've had patients in here who have been to specialists in New York, who have been to the best of the best, that have had multiple TMJ surgeries and been through the ringer, and can now eat real food, don't just have to drink out of a straw, and sort of reorient their life around their TMJ. I hope you have gathered some really good information about atlas misalignment and how that can feed a lot of the dysfunction and then symptoms that you've been suffering with. So I want to categorize who's probably watching this into 3 groups. 1, you're not local to Stuart or Martin County. You're watching this from somewhere else. If you do have a problem up here, you think you might have a problem up here and you want to get checked, you want to see an upper cervical practitioner, I'm going to put a link in the description for an advanced orthogonal chiropractor. That's somebody who does the kind of work we do in our office using the sound wave, the digital analysis, but the sound wave to correct the upper neck. Also, I'm going to link NUCCA doctors and a directory for them, because there's only about 50 or 75 docs that do advanced orthogonal work. So we're kind of sparse throughout the US. So you may have a better shot at finding somebody who does NUCCA that's a little closer to you. All right, so that's the first group of people. The second group of people are local. They're located somewhere around the Stuart, South Florida area. And you think you might have a problem, or you just want some more information, I want to encourage you to attend our upcoming free dinner workshop. It's going to be this month, and there's limited spots. We only have about 30 seats at that dinner. The real awesome part about the dinner is if you do show up for that, it's on a Monday night. Just for being there, you can get a certificate to save $150 on upper cervical x-rays. And I do this because we get the best patients this way. I have the best results with the kind of patients that come to a workshop like this because they're health-minded. So I'm willing to, 1, comp that dinner, that Italian dinner at Fiorentino's, and 2, if you're willing to come in and get checked out and take a look at your neck, I will even comp the cost of taking very specific x-rays of you and analyzing those x-rays. Because I know if I show you what's going on with your neck, you're going to want to get fixed up because there's no drugs or surgery involved here, and you can be feeling a whole lot better. So that's the second person. The third, you know you're ready to make an appointment. You've been praying for this, and you found this video. I don't think you're watching it for no reason. It's on an accident. You know you would just want to come in and get checked out. I want you to call 772-220-2207, and our office manager will call you back, and we can get you in for first available to get checked out and see if you do have a problem with your neck. All right, thank you for watching this, and please subscribe. Please like this video. Please share it with anybody that's got something similar going on. We're trying to get the word out about this kind of care so less and less people are on drugs in this town and getting lined up for surgery that's unnecessary. So please join the movement and helping us spread the word. And again, thanks for watching, and God bless.